This segment is sponsored by Tecton Research.
The folks at Tecton Research play an important part in bringing new and effective medications to people who need them. Dr. Paul Pickrell is here today to talk to us about a new seasonal virus clinical study that Tecton Research is performing. Dr. Pickrell, good morning to you.
Good morning. Thanks for having me.
Doctor, I've been hearing a lot more about it the last few months than maybe I ever have before. Can we talk about what RSV, or respiratory syncytial virus, is?
Sure. Respiratory syncytial virus is one of the most common cold pathogens we have. It's an upper respiratory tract virus that's been around since 1956. It primarily affects those very young and those older. Normally, people will have it and transmit pathogens for up to 1 week. They'll have simple symptoms such as runny nose, cough, sneezing, wheezing, maybe a little lethargy, irritability if you're a child. And then it simply goes away. But unfortunately, for those infants who especially are premature or have heart or lung disease, and those older individuals with some autoimmune or immune deficiency states, it can be quite serious. And that puts people in the hospital. We've had 200,000 hospitalizations per year, up to 14,000 deaths per year in older citizens. And our work is trying to prevent that from happening.
Let's talk about older adults more specifically. How serious is it?
Most adults, as I say, it's a common cold and they do get through it. But if you have comorbidities, especially COPD, you're a long-term smoker, you have heart disease, then it can be quite devastating. Similar to what we found with COVID, the same comorbidities that put you at risk are likewise with this virus.
The cases of RSV have really drastically increased this year in a way that I haven't noticed before.
Yeah, it's fascinating because it is record numbers. This is true. Having almost disappeared last year. We kind of laugh that it was such an awful year for the pandemic and viruses, but with our mitigation strategies, wearing masks, social separation, hand washing, hygiene in general, we almost saw it go away. And influenza was one of the lowest years we've ever seen. So now that we're going back and relaxing those mitigation strategies, those who would normally have been immunized in the very young group are now seeing this virus for the first time, and it's proliferating in ways we've never seen. Summertime, we never have RSV, but yet we've had record numbers. So the omen is that this winter may be one of our worst winters on record for RSV.
Tell me more about what you're expecting for the season ahead.
We've already seen record numbers now. We're not in the peak of the cold and flu season yet, and it could be dire. We don't know that it will replace. It certainly doesn't have the mortality that the COVID-19 did, but we are worried enough about it. And the beauty about our research through COVID-19 vaccines is we've come up with brilliant research through vaccines for RSV. Some of them are mRNA, similar to what we saw with Moderna and Pfizer, and others are more traditional vaccines. We have a number of sponsors that are doing trials and that we're very active in at Tecton Research, as we were with the COVID-19 vaccine.
Can we talk about the advantage of having something like a vaccine for this sort of illness?
With the vaccine, we can prevent the disease from starting. So those people with the comorbidities, heart, lung disease, elderly, immune compromised, if they were to take the vaccine, then they would never succumb to the signs and symptoms, never go to the hospital.
There's a clinical study going on. How many volunteers are needed and when are they needed?
Well, we need them now. And just as I always tell the patients who show up for our COVID trials, they're the true heroes in our COVID prevention strategies. They were the ones that volunteered a year ago. They put in the time, sweat, the blood. They were the first to receive the vaccine, and they helped us immensely. The same can be said for anyone who volunteers for the RSV vaccine.
Any qualifications for the study, and how long can they expect it to last?
Some of the studies go for 1 year, some go even longer than that. There is remuneration for patients, certainly for their time and travel. They also feel like they help the world with regards to the studies and the research that go on. So it's kind of a win-win for everybody when you volunteer for these trials. But I need anyone over age 60, and especially over age 65. If you have health problems, then that's even more welcoming. And then we have one state that combines it with the flu vaccine. So if you've not yet gotten your flu shot, we would really recommend those patients call us. We'll give them a free flu shot combined with an RSV.
So what should somebody do if they're watching this morning and they're interested in participating?
They can contact us at tectonresearch.com, or we have a phone number. It's 512-812-7921.
Dr. Pickrell, thank you so much for your time. We appreciate it.
Thank you.
To learn more about Tecton Research and enroll in the seasonal virus clinical study, go to tectonresearch.com or call the number on your screen. This segment is sponsored by Tecton Research.